You're watching an RH Reality Check production brought to you by rhrealitycheck.org.
This woman is being escorted to an abortion clinic when a protester yells for her to reconsider her decision.
She doesn't have to do this. There's a crisis pregnancy center across the road that's waiting to minister to her. And we pray that you would help her to see that.
The crisis pregnancy center across the road is set up to talk women out of having an abortion. All part of the culture war and all perfectly legal. But as crisis pregnancy centers are spreading across the country, they're moving beyond ideology and often giving out inaccurate medical information, proselytizing, and using shame and fear when counseling young women seeking advice, sometimes using taxpayer dollars.
The Right to Life movement, or the anti-abortion and anti-family planning movement, went after the government's family planning money. And essentially right now, in family planning programs, which are supposed to be used in scientifically and medically approved programs, they are now giving about half of those dollars to what we're calling fake clinics that really proselytize against abortion and birth control, and by giving out false information actually are injuring these women.
For example, crisis pregnancy centers are counseling young women that abortion causes breast cancer. One counselor gave this advice to a young woman.
Your risk for breast cancer go up 100%.
100%?
100%.
That's not good.
Pamphlets were passed out at almost every crisis pregnancy center we visited around the country, warning about the dangers of breast cancer.
Talks about the long-term risks of an abortion, and one of the first ones listed is breast cancer. But if you flip to the back and look to the sources that they cite, the ones that they cite are from the World Health Organization in 1970 and the International Journal of Cancer in 1983.
Not only is the information outdated, it's wrong. The World Health Organization's website explicitly states that abortion does not cause breast cancer. These centers, over 2,200 of them across the country, set themselves up next to college campuses, near medical centers, to project an image of professional care.
Well, I personally thought that the fact that it was going to such lengths to pass it off as a legitimate medical institution was really appalling. I mean, this place was literally down the hall from a cancer care center, and it was in a place like in the city. It was right next to the hospital. It was right next to my doctor's office. It was right next to my pediatric doctor's office when I was a kid. I went there too.
The woman who was talking to me was not a nurse.
Her name tag said that she was a nurse.
A nurse manager. She said she was a nurse manager, but she was not a nurse, like a licensed nurse practitioner.
In addition to inaccurate information, these centers also use scare tactics.
She told me that she's counseled many women and that 95% of them regret it.
It's a true medical condition called PAS, it's post-abortion syndrome. And they have a lot of issues mentally, physically, and sometimes even spiritually with that choice.
Is that like right after or?
All through their life.
I'll read directly from this pamphlet. They state that women who had abortions have a 154% higher risk of death from suicide. They have an 82% higher risk of death from accidents and a 44% higher risk of death from natural causes.
The video indicated that if you were to get an abortion, you would be 2 times more likely to suffer from depression, 2 times more likely to engage in drug and alcohol abuse, and 3 to 6 times more likely to commit suicide, which blew us both away. And they referred to the doctors who performed abortion as abortionists, never gynecologists, never obstetricians, never doctors, abortionists.
No one tells you that you want to kill yourself after you do an abortion. And I never thought I would be the type of person who would try and kill myself after an abortion. I thought that I could handle it and that I could deal with it. I haven't had that abortion turn me into a crackhead whore, and no one told me that would happen.
Seeing the video that I was shown at the clinic today, it really made it seem like every woman who has an abortion is emotionally scarred forever and that she regrets her decision and that she might be more prone to having breast cancer, she may become infertile or whatever. There's many kind of fear factor things that they tell you. I had an abortion when I was 18 years old, and the moment I found out I was pregnant, I had zero question in my mind that I was going to have an abortion. There's not been one day in my life that I've regretted my decision. I'm really grateful that I had the option. I am 100% certain that I was not ready to be a parent at that time, and I was able to have a full life and experience my life as it was meant to be, as opposed to, being thrown into premature parenthood, unplanned parenthood.
Sometimes misinformation may be intentional. In Pennsylvania, Megan Eschman went to a clinic with a friend who thought she was pregnant.
And she took a pregnancy test, she watched some videos, they gave her literature, they brought her back down, she sat with me, and then they came back and told her she wasn't pregnant. We actually walked outside thinking that she wasn't pregnant, feeling relieved, and then I looked at her and I'm like, "Are you sure?" And she said, "I don't know." So we went back down, walked down to 2 more blocks to CVS, bought a pregnancy test, and we went back to our dorm room, and she took it, and she was in fact pregnant. So that misleading information, she could have been drinking, she could have been smoking weed even. She's at college, and it was endangering not only her life, but the fetus's life. In my mind, they're either telling her this so that she can keep developing the fetus inside of her to a point where she can't have the abortion medically or legally in Pennsylvania, or they really didn't give her a pregnancy test.
God is frequently mentioned during these counseling sessions, which would be okay if it weren't sometimes illegal.
You've got to trust that God will be with you. I don't know what your spiritual life is like, but if you had God with you every day, you say your prayers, He will see you through and see you through any situation.
Any agency that receives state or federal dollars cannot use those dollars to pray with their clients or distribute Bibles or talk to them about, to couch their counseling in religious terms.
Consider, for example, Elizabeth's New Life Center in Dayton, Ohio. It receives funding from private donors along with millions of dollars of taxpayer money.
Going in knowing that they had kind of relatively large amounts of taxpayer money to work with made it really uncomfortable for me and shocking to me that my spiritual health was kind of at the foreground of their minds and their worries, and the ways in which, along with physical and emotional consequences, always spiritual consequences were presented to me, and they're in the literature, and they were presented to me verbally as well.
From what we can gather from the tax forms that are available publicly, there are some serious red flags. For example, in Elizabeth New Life Center 2009 990 tax return, it looks like they are receiving about $3 million in government contributions, and their overall budget is about $4 million. So when 3/4 of a crisis pregnancy center's budget is coming from the government, and they are engaging in the type of religious activities that you described, it raises serious red flags that the CPC may be using government funds for religious purposes.
Elizabeth's New Life Center declined to comment on camera, but they wrote us an email saying they do not proselytize in programs that are funded by taxpayer money. They said their staff is very careful to separate the private donations from the federal grants. But with millions of dollars of abstinence-only money going to crisis pregnancy centers across the country, critics want better oversight.
Congresswoman Carolyn Maloney has been carrying legislation that we hope finally starts to move now through Congress that would require truth in advertising for these so-called crisis pregnancy centers. Secondly, we hope that with a new day in Washington that we're going to see a cutting off of the federal dollars that have been going to abstinence-only programs that include these crisis pregnancy centers. We should be funding only scientifically, medically based information sources and services for young women and men in this country, and that's what's so critical.
And until Congress acts decisively, young women are left to figure out accurate medical advice for themselves.
When talking about medical procedures and surgical procedures, I feel like a woman must consult the people doing the procedure, consult people who have licensed medical knowledge of these procedures. And I just think that when a woman, especially one my age with low income and in the middle of her education, that these are all skewed bits of information that would really alter my ability to choose in a fair way.